I don't know.
All right, I think we're good.
Ready to go?
Sorry,
Okay. I'm going to call the Richland County Community and Health Services Standing Committee to order. Today's October 2nd, 2025 and 9:33. Roll call?
See Miller.
Here.
Kramer.
Here.
Engel.
Here.
Hendricks.
Here.
McGuire. Harris.
Here.
Brathwaite.
Here.
Inchiker. Yep.
I next need a motion to approve the agenda. We have 17 points on our agenda this morning.
Number 3.
Number 3. Yeah. Okay, who moved?
I did.
Larry? Need a second?
Second.
All in favor, say aye. I'm sorry, Dave, skip number 3. Verification of open meeting law compliance.
Yes, Madam Chair, the meeting property.
Thank you. Now I need a motion to approve the minutes from our September 4th, 2025.
Do we need the agenda?
We already did that.
Okay, I'm sorry. I lost, okay.
I made a mistake and skipped over the open meetings law. Okay, do I have a motion to approve the minutes from September 4th?
Also move.
Do I have a second?
Second.
Is there any discussion, changes, or deletions that need to be made? Okay, if not, minutes will be declared approved as presented. Do we have any public comment this morning? Online or from the committee? Hearing none. Get to the committee. Number 7, the election of committee chair and vice chair. How do you want to do this, Derek?
You can have a motion for someone.
Okay. Well, I need a motion. We'll start with the committee chair. Is there anyone that would like to make a motion for the committee chair for this?
I'll make a motion to be the chair.
Okay.
I'm learning the rules.
Cindy, my only difficulty with former county employee having a committee chair, I just struggle with that. So I think, I mean, I'd be willing to serve as chair if that's needed. I just think you need a different set of eyes. And if you're in the county system, yeah, I just think.
All right, I've been retired for over 15 years already. A lot has changed. I was not here underneath the administrator. I was here when Mr. Victor Vlasic.
And that's precisely my reasoning.
New era.
Right. It's still my reasoning.
Okay. All right, any other nominations for chair?
Ask 3 times. So you just-
Any other nominations for chair? One more time.
Yeah.
Any other nominations for chair?
So I guess, are you interested in it?
I would do it. Yeah.
Okay, I guess I'll nominate Larry.
Well, he's already nominated himself.
Okay.
All right, we have 2 nominations. We have Larry Engel and myself. So we will have to take a voice vote. All those in favor of myself becoming chair? 2, 3, okay, and I don't get to vote, do I? I don't think
Well, you
so.
can, you're on the ballot.
Okay.
You can nominate yourself.
I'll nominate myself. Okay, so that's 1, 2, 3, 4. All those for Larry Engel, please raise your hand or say aye. I don't,
You have it.
okay. All right. Now we need nominations for vice chair.
So, Madam Chair, may I just clarify that you take a voice vote for the election of the chair of the Community and Health Services Standing Committee?
Yes.
And the majority of that voice vote is that Sandy Kramer be appointed the chair of the Community Health Services Standing Committee, correct?
Correct. Now we're on to the vice chair.
Yep, and then we're gonna make, yes.
Okay. Need nominations for vice chair. Anyone?
I'll nominate.
Larry?
There you go. Most good people. So simple.
Okay. Any other nominations for vice chair? Okay. Hearing none. Any other nominations for vice chair? Any other nominations for vice chair? Any other nominations for vice chair? Hearing none, Mr. Larry Engel is nominated for vice chair. All those in favor, please say aye. Aye. All those opposed? Hearing none, Mr. Larry Engel is the vice chair. Okay, moving on to reports. First one is the Health and Human Services Director Administrative Report.
Sure. Hi. Good morning, everyone. I almost said good afternoon, but it's 9:30 in the morning. Sure. So the first thing is in your packet, you'll see the unit updates for Health and Human Services. In the ADRC highlights are the Rise and Dine at the Food Center was a success, hoping to continue that. Transportation trips are coming up, so note that. They got the fall color ride, going to some apple orchards and whatnot. Big news in the behavioral health unit, our behavioral health manager resigned. So she's no longer with us. Just wanted to get back to her roots in counseling, so we wish her all the best. Gonna miss her. So in the meantime, if you have any behavioral health type questions, you can route those through me. I've got the Lori Cooey, the unit supervisor. She's stepping up and doing some things with some additional supervision. Roxanne's helping us out with EPS type things. And so position is posted. So hopefully we get some good candidates for that. Yeah. In economics, in the child and youth services, they had 8 more kiddos that found permanency, so that's exciting. In economic support, if you read through there, staff continue to exceed call volume and workload goals. Note there are a couple of days in October where the call center will be closed. We just like to throw that out there so the community is aware that if they try on those days, they'll have to call the next day. Public health, I won't go into too much, as Evan will be presenting in a little bit, so I don't want to go too much into that, but just note that flu vaccines are in and clinics are happening. So that's that. And then all I have as far as the agency wide is I did send out a press release so we could to accept applications for the opioid settlement funds. We do that grant announcement it's supposed to be twice a year, but I'm a little behind. So, but yeah, so I did send that press release out and the plan is to bring those in November. So for you guys to approve and review. So that's it for administrative reports.
Well,
Yes,
Reason for the resignation.
she just wanted to get back to her roots in therapy. She's a counselor.
Still here.
She's still in the county, yes. She's still within the county. But just not working for the county anymore. So,
A couple months into the job, I'll
Who?
give enough support. You,
who, me?
yeah, just checking to see if you need anything or.
Well, right now, Kaylee's on board, so that was huge. Once Kaylee came on board, that was wonderful that some of the financial manager duties could get passed along. Like I said, Lori Cooey is jumping in and helping out with a lot there. Roxanne down there, she's jumping in. The managers have all been great. And I have sort of I have a unique situation that a lot of newer directors don't have. I also have Trisha Clemens, who's also right here. So, but yeah, no, thank you for asking. And I'm putting a little extra hours, but it's comes with the job and so far so good.
You let us know if anything should change.
I for sure will. I mean, depending on what kind of, candidates we get for the behavioral health manager position, if we get any, that's gonna be key. So once that posting comes down, I'll have to definitely relook at that. And when that comes about, I might be asking for some thoughts on, maybe, I don't know. Lots to think about. So, but yeah, I will definitely reach out. Thank you.
A lot goes on.
Mhm.
There's a lot
A
goes on.
lot goes on over there. So, but got some good managers.
All right, we're moving on to reports underneath letter B. HHS expenditures report, vouchers and expenditures over 2,000, but less than 10,000.
And Kaylee is going to do these this month. I'm excited. She's gonna try it.
Yes, so for item B, all expenses looked good. There was nothing particularly out of the ordinary for last month. A few non-routine expenses did come up. We updated our lighting with Michael Marshall, which was about $1,475. And then CMS requires us to re-enroll every 3 years to remain as Medicaid and Medicare providers, and that was about $730. We also refilled our postage meter at $4,000. This is a routine expense that comes up periodically, but the dollar amount does make it stand out more than most. And then something to note for our future expenses is that you won't see any more Walmart expenditures on this report after this month. We have parted ways with that credit card company, and then moving forward, any Walmart expenses that come up will just go on to our main credit card. So that is item B. Segueing into item C, budget summary and placement reports. Through August, budget utilization is at 65%, right in line with 67% of the year elapsed, and most programs are pacing as expected. We do have a few areas that are running in hot. CCS at 75.6% and Children's with Disabilities at 87.9%. However, both are fully reimbursed programs, so there's not a great deal of concern there. Child and Youth Services and ADRC are closer to 55 to 60%, showing balanced use. Our core balance is showing a surplus. Anticipated revenues are finally catching up with expenditures. For example, we received additional WIMCR revenue from 2023, just as Stephanie had forecasted last month, so that's looking good. So bottom line, there's no concerns at this time. For our placement report, placement funds are leveling off since we no longer have high cost cases. An important reminder, 1 or 2 high cost placements can really swing the budget dramatically. And this month, the shift has actually worked in our favor, so knock on wood there. With the placement report, I will draw attention, there was an addendum made, which is linked. You should be able to see that if you're using your iPad. There was just a cell that had gotten thrown off in May under the adult community residential placements, so those numbers have been since corrected.
So yeah, so in your packet, there should be a corrected version of it. Yeah, there was a cell that was, the cell formula in one of the cells was not accurate. So, so originally, our original one, I think we had 41% utilization, but we're actually 58% utilization, which is still in line with where we should be. We're not over at this point. And then while we're talking about the placement report, I wanted to kind of touch base. I did listen to last month's meeting because I wasn't here. Roxanne shared with me that you guys had some questions about like sort of what is the actual daily cost to the county. And so then I kind of looked into it a little bit more, and I think if we really look closely at these placement reports, it does kind of break that out for us. So like for example, year to date for 2025, if you take the total of like the adult placements, the total expenses of $408,715, that is the cost to the county. And then if you just divide that by the total number of days, right now we're trending at about $197 a day for people in placement. So I know there was a question about the placement that we brought forward in a contract last month that was over $2,000 a day. That's just that particular placement. They're all over the place, as you can see. You know, that does reduce down to $197 a day. So it's, you know, if we.
Well, so you're saying it's going from $2,000 a day now to.
As an average.
$197 For the taxpayers.
Correct.
Here.
Yes, that's how I would explain it.
That's
So that they're not just focusing on that, the one individual rate. As an average, it only costs about less than $200 a day. And every year fluctuates. I mean, I went all the way back to 2021. 2021, it was $174 a day. 2024, $242 a day. So it just is all over the place.
It just depends where they are, right?
It depends on where they are, absolutely. And what kind of revenue we can draw down to offset that. And I think Roxanne explained that perfectly last month. We go, some of the placements, they're enrolled in our CCS program or Comprehensive Community Services Program. So then they're able to, we're able to get reimbursement for those services through CCS Medicaid, which is 100% reimbursed. So, and then of course, then clients, if they're in like an adult family home or something like that, they do contribute to that placement. They pay what's called room and board. If they're in an institution, if we can get insurance to pay for it, we do. Medicare pays for some of it, depending on the situation. So, but yeah.
all this, the $2,000, I still bet.
Sure, for sure.
So you're just pushing that in with everything and giving me a general,
Correct.
an
An
average.
average.
So is that the way you always look at it?
That's the way I look at it. Yes, absolutely. And I look at what kind of reimbursement we get to offset that $2,000 a day. Now, with that said, if this individual would no longer be eligible for the Comprehensive Community Services Program, obviously that average would skyrocket, right? Because that $2,000 a day then does become a county taxpayer expense. It's and because we also have to offset it from a behavioral health perspective, right? We have to put them in the least restrictive environment. And sometimes those are gonna be a little more expensive depending on their needs, right? So some of them are just high cost. So, I mean, think about Winnebago too. Winnebago's what, was it 15, 16, 1,900 a day? I don't know, it's something. It's a lot too there at Winnebago, and that's a state-run agency, so. So I think if this person would end up having higher needs, and we had to put the person in a more restrictive environment, that was gonna cost us what the Winnebago rates are, which is, I think it's 1,900 now, I'm not sure, I'd have to double check.
And I think there's an add-on too,
And
if
there's
she
an
needs
add-on
more, if
so.
individuals need more care, then I think they can add on up to almost 500 a day. So it could vary, but they do a really good job of getting people out of those high cost placements. So.
You only had one in last time, but it just threw me. You know,
It throws me too when I see the contract rate sheet come in. Whoa.
thank you.
Did that answer the question? I wasn't here, so I was hoping I was kind of getting at what was being
Yes,
asked.
that was the question I asked.
Okay.
yes.
Okay.
But I specifically asked for the 2,000 to see how much that actually cost. But if you put it in with all the others, it doesn't.
That one, right now, currently, back up with, is costing hardly anything because of the CCS program.
I can't even.
That one's hardly costing us anything right now because of the CCS program. So, and then two, the other thing I'm just gonna throw out there, I don't wanna worry anybody, but if they ever change the reimbursement rate for that, right now they're reimbursing 100%. There was a point in time where it was 60-40, counties had to pitch in the 40% on that. So, but knock on wood, I haven't heard that that's gonna happen. There was kind of a rumor way back at the beginning of the year, but I haven't heard that recently, but that's always kind of in the back of my mind, what happens if, so. Yeah, no, thank you.
Any other questions or comments? 26 Health and Human Services Budget Update.
Yeah, so the 2026 budget is still working through the approval process. There's been no changes since it was previously presented last month. So we don't really have anything more to add to that. The budget's just reflecting a balance just between trying to grow our service demand. Oh, I'm sorry, between growing service demands, rising staff costs, and just remaining fiscally responsible.
It's when do you go in front of the Finance and Executive Committee with this?
We do not,
You do not.
no, it's all taken care of by the county administrator.
Budget hearings, October.
Okay. Anybody have any questions? Hearing none. We are moving on to item number 9, mental health presentation.
Morning, everyone.
Good morning.
There is a PowerPoint. Okay. It's actually in the packet. You can get the packet back up and share it. We're getting there.
I was doing a marriage lessons earlier, sorry.
Oh, that's okay. Yeah. I just thought it was easier just to scroll through the packet than actually do a PowerPoint. There you go.
Share my screen.
All right, so my name is Evan Ewing. I'm a public health specialist with Richland County Health and Human Services. And I'm going to talk about our community health improvement plan updates so far. We started implementation in May of 2024, so we're a little over a year into implementation. Go to the next slide, please. So just some background and context on when we say CHAW and CHIP, just wanted to provide a little context for that. So health departments, specifically public health, we're responsible for implementing a community health assessment, which is the CHAW, and then the CHIP is the community health improvement plan every either 3 or 5 years. So you might be familiar, the Richland Hospital is doing theirs right now. I believe they operate on a 3-year cycle, and we chose the 5 years in public health. So the last time we did ours was in 2022. And we identified 2 priority areas to focus on, and those are substance misuse and mental health. With substance misuse, specifically adult binge drinking was the substance of focus for that. And when we were brainstorming implementation, we decided that 2 separate work groups would be the best way to address the causal factors leading to those 2 priority areas. So when I say causal factors, those are factors within the community that are leading to these problems or issues. So our goal with substance misuse is to reduce binge drinking among Richland County adults. And the factors that are contributing to adult binge drinking are community norms. So that would be like the pervasive drinking culture, like just Wisconsin's known to be a place where people consume a lot of alcohol. So that contributes to it. And then also stigma around seeking services for a substance misuse problem. And then for mental health, our goal is to improve the mental health of Richland County adults, and the causal factors leading to poor mental health are access to mental health services or lack thereof, and then the mental health stigma. So these are sort of our blueprints for CHIP implementation. And these are located within the CHIP documents on the county website, so you can actually access and view these. These were developed before my time with working in public health with the county, but coming into implementation, it's a nice action plan for addressing these 2 priority areas. So these are 7 strategies for community change that are aimed at addressing different levels of change within the community. So kind of at the lowest hanging fruit level is providing information all the way up to modifying policies within the county. So modifying policies has the greatest impact, but it's also probably the most challenging to implement. So you can see the measures underneath the strategies there, and that's sort of how we measure our progress in implementation. So you can access these. I'd encourage you to take a look. We're not following these to a T just because these were developed in 2023, I believe, for this part of the CHIP. So obviously things change over time. So we're kind of adapting this as we go a little bit as well. So I'm just briefly going to talk about substance misuse, and then I'll spend a little bit more time talking about mental health. But for the substance misuse priority area, we've partnered up with the Partners for Prevention Coalition and their alcohol work group. So they have a subcommittee that focuses directly on alcohol. So we thought it would be a sort of logical collaboration for that. Just some of the work that we're doing, alcohol compliance checks continue in partnership with law enforcement. So trying to ensure that those that are 21 or younger than 21 are not having access to alcohol. And then event safety is the other portion I would say that I'm most involved with within the alcohol work group. So working with local events, we worked with one within the county to implement signage. So indicating that we're not going to serve people that are under 21, we're going to card you, those sort of things. And then event assessments continue every 2 years. We do that to collect data on alcohol service best practices. So are people carding at those events? Are they, providing wristbands? Are there gated areas for people to consume alcohol? So those are some of the things we're working on with event safety. And then we're going to be doing a beverage server training at the Phoenix Center on November 3rd. So people that have liquor licenses are encouraged to come and learn about how to check IDs and give their staff that training opportunity. So diving into mental health, this was a new work group that we started from scratch essentially when we began the CHIP implementation. And one of the main things that we've been working on is mental health in businesses. So trying to assess our employers providing their staff with mental health resources. So we provided the survey to many businesses within the county. 21 completed the survey, and of those 21, 13 were receptive to receiving additional resources. So we created this mental health business toolkit, and I just took a screenshot of about the top quarter of it over there. But basically we provided businesses with this resource that has QR codes as well as embedded links and information on those resources that they could provide to their employees. And there's also resources on there for how the employer themselves can shift their workplace culture to be more inclusive and positive around mental health. So one of the businesses, I put the quote in there, I'm not going to read the whole thing, but just in general, they provided some great feedback to us that they shared it on their employee Facebook page. They posted it within their organization, and their staff found it to be very helpful. So the goal here is to improve that access. So if there was a mom and pop business that they don't have an employee assistance program, they're not giving their staff any resources for mental health, this would be a way that they could provide sort of a one pager to their staff and get them some of those resources to make them more aware. Another intervention that we have done in the last year is our Mental Health Matters Mental Health Awareness Month campaign. So I don't know if any of you have seen those window clings posted around businesses in town here. We partnered up with RCC FAC and implemented this campaign in May, which is Mental Health Awareness Month. We provided it was a letter that described the observance. So what is Mental Health Awareness Month? We provided resources to those businesses and then also the window cling, and that went out to over 70 businesses within the county. Many of them placed them on their business, and you can still see them up today. And then I promoted this on WRCO in April of 2025. So there was some good feedback. I think it was on Richland Rants and Chats, just kind of some qualitative data, so to speak, of people in the community that saw believe the window cling on the Richland family restaurant and provided some kind of positive verbal feedback around that. So it was cool. Another intervention that we did for Mental Health Month was collaborated with the Walk Around the World with Grace. So Leif Carlson and I met and discussed kind of how we could work together to share more resources on protective factors for mental health, like physical activity, stress reduction, those sort of things. So in the month of May, I presented at the monthly potluck and just presented on mental health, kind of some of the work we're doing. And then we provided unique weekly content that was shared via email with the Walk Around the World with Grace participants. This is a screenshot of one of those resources. So just some general information on physical activity and mental health. And then we always included a QR code or a link to some resources there. So those were done on physical activity, mindfulness, stress reduction, and mental health resources. And those were sent to over 310 participants each week throughout the month of May. And then most recently, we've been implementing our mental health skills training. So we provided a stigma reduction mental health presentation called Make It Okay. Make It Okay is a curriculum and campaign that was developed by health partners in NAMI, Minnesota. And the main goal with that is to reduce mental health stigma. So if more community members are aware of what mental health stigma is and how to reduce that, then it should, in theory, improve or reduce stigma within the community. So we provided 3 presentations since August. We did one for the CST and COOP coordinating meeting in August. We had 7 people attend that. I held a community event at the Brewer Public Library last week, and 11 people attended that. And then we worked with Schmidt-Woodland Hills last week and provided 2 separate presentations for employees with a combined 42 people in attendance for that. So 2 work group members are trained facilitators in the Make It Okay curriculum. So myself and Alicia Woodhouse. And like I mentioned, it's developed by health partners in NAMI. So it's more of an evidence-based curriculum. And this is just some more specific information and feedback from the community-based version that I gave or provided at the Brewer Public Library. Like I mentioned, we had 11 people in attendance. 3 were members of the work group, or 1 was staff from the library. 8 surveys were completed post-presentation. All reported that the content was relevant to their lives, increased knowledge and knowledge of stigma and available resources. And all reported either 4 out of 5 or 5 out of 5 likelihood to share the information with others in the community. We had some positive feedback from those surveys as well, that they enjoyed the presentation, found it helpful, and enjoyed that opportunity to share with others in the community. And Alicia provided a resource table at that event where we shared lots of resources on Make It Okay, as well as resources within the county as well. And then I mentioned the Schmidt-Woodland Hills mental health skills training presentation. We had those 2 groups that we presented to. We provided the same resources to them as well at that event. And instead of handing out a paper survey for a larger group, I had a QR code where they could scan it and complete a virtual survey. We only had 1 person complete it, but the feedback was positive on that. And they indicated they'd be likely to share that information with others. And then lastly here, just looking ahead, our plan is to continue to work with businesses in the county. So trying to work with them, assess what are their needs for mental health, and providing that information to their staff, and offer our support and providing resources. Working to assess what screenings are currently offered in healthcare facilities, and then what do those next steps look like for people that maybe screen high for mental illness. Trying to continue to expand those community versions of the Make It Okay presentations to address that causal factor of stigma. And then right now in our most recent work group meeting, we're working to promote some more of those protective factors. So promoting the connection between physical activity and improving mental health, social supports, mindfulness, those sort of things. So that's more of our looking ahead specific to mental health. That's all I had. Does anybody have any questions about the work that we're doing?
Yes. I can see you have a good plan and you can measure your implementation. But how do you measure whether you're getting results or not? It's a lot more difficult.
Yeah, for sure. There's 2 long-term objectives that we're looking at. We utilize the county health rankings and roadmaps data, and not sure exactly the frequency of when they collect that, but it shows the number of poor mental health days reported by Richland County residents. And that's one of our long-term objectives. The other metric is it's part of our CHA assessments. So that won't be done again until probably 2027. And the poor mental health days, I believe it's a 2-week measure. I don't have it available kind of off the top of my head, but those are some more of those long-term objectives that we're looking at. Would be like surveys to determine kind of where people are at in terms of mental health. Obviously there's, limitations to that, but yeah, those would be kind of our ways to measure that progress over the long term.
Have you seen a difference? I mean, measure the rate of alcohol use in juveniles before and after these implementations?
So there's YRBS data, which is a youth risk behavioral survey that's done, I believe, every 2 years. That's probably one of the main ways that we can measure for youth. For adults, it's a little bit more tricky. I don't have that information off the top of my head, what those long-term measurements are for substance misuse. I believe one of them was emergency room visits due to related to alcohol was one of them. And I apologize, I can't remember the other one off the top of my head, but looking at those more long-term objectives is kind of how we measure that progress with these. The event assessments can tell us if events are implementing those best practices. So we do reach out to all of them and send out it's like a toolkit resource that outlines these are steps that you can take to make your event more safe. And then we do those event assessments every 2 years. And then compliance checks are another way that we measure if youth are able to access alcohol. So those have improved since their inception. I think it was in the 40% were compliant when we first started those before my time. And I think we're up into the 80s now. So that's improved. I'd have to, go look at the hospital data and check in with them on that. But a lot of those measurements are more specific to the interventions until we get to the end of the CHIP implementation, that we would assess those long-term objectives again. Questions?
Any other questions?
So, just to, if I may, I invited Evan here because at one of the meetings, Mr. Engel asked about, we were having a conversation about mental health in the community, and I think it was maybe more about access maybe, and because we're still trying to fill a therapist position and those kinds of things. So, so I brought Evan here because he has some insight into the work being done. I don't know about the access piece of it. Is there?
I think what we heard from people in the community meetings was that access is still an issue. If people have an employee assistance program, then they can access therapy through virtual means, which can be beneficial. But for people that don't have an employer, I think that's where the challenge lies in that. And we're trying to promote things like support groups. NAMI offers one through Dane County that is virtual that they came to National Night Out and gave us some more information on that. So specific to therapy though, I think it's a little bit more limited within the area.
Because we lost Paquette too, so that was the other thing, so.
Yeah.
Well, we wanted to raise the question too, because access is critical.
Yeah.
And psychiatrists in the county, we have very few access to that.
So, right. So,
Rising mental health issues, depression, anxiety, insurance really doesn't fund a lot of mental health work. So it's not profitable to engage in that. So it's a pretty big sea. It's in waters that are out there.
Yeah, for sure.
so at Health and Human Services, we still have an AODA counselor. We do have a psychiatrist, APNP, a psychologist. So we do have some of those services. They're pretty booked out though. So that's, there's that. Kaylee did reach out to some of her old contacts at the hospital. And they're working on some things, behavioral health counseling in Muscadet. They're still kind of looking at adding some services out in Muscadet. There's a Dr. Cullen that still does psychiatry. And they do actually have a suicide prevention group that they have over there as well. So the hospital still is dabbling in it as well.
Mental health issues are going to increase.
Sure.
How many actual counselors do you have seeing patients on a daily basis?
On a daily basis?
Well, not seeing the patient on a daily basis, but I mean seeing clients on a daily basis. John used to be here.
John used to be here.
Okay, but anyway, he was one of them, but he had two other people working with him. Like he had out there in the building out by the campus, John Pine. And they had a nurse out there and they had another counselor, so they only really had two. And that's been 30 years ago.
I don't know how many other agencies would have, I mean,
He worked for the
ultimately,
county. He worked for the county.
that was way before my time
Is
then.
it-
Well, yeah, oh yeah, it was, but he was a counselor.
Is it Pine Counseling? Is that his business?
They had, yeah.
I think they're operating over like across from AutoZone and that business center
So how
there.
many are there? I mean,
All that, I don't know.
Yeah, I'm
is
not
the
sure.
clientele way more than what we have there working?
Not sure, yeah, I don't have that information. I think our big goal is to reducing stigma, you can allow people, it makes people more likely to seek out the help that they might need. And the goal would be to do that further upstream than when they get to a crisis level. And so I think the crisis amount is increasing a lot because people aren't feeling comfortable to seek the services, or they're not able to seek those services before it gets to that level. That's kind of where we're trying to lean more into those protective factors, those further upstream factors like social supports, mindfulness, those stress reduction, those type of things to hopefully lessen that burden downstream.
You might wanna, I don't know if we've already considered it, but these kids, I call them kids, but even myself included, military people. When I was in the military, you did not speak about any mental health issues whatsoever. Otherwise, you could face ruining your career. But it does happen, and the people that get out of the service, it's been drilled into us so much that we still have a fear of bringing it forward.
It's a good point and consideration, I think, with your Veterans Day coming up in November too, maybe looking at considering that population a little bit more with specific effort and focus on them.
Because even the younger generation that are coming back now, yeah, they might have physical disabilities, which really weighs them down, but
For sure.
the military is trying to get that stigma away, but it's gonna take years
Yeah.
and years for that to happen.
For sure. Yeah, it's still cool.
Just make one comment. So I was at a training on Monday and this actually came up about psychologists and psychiatrists. So counties across the state are struggling with finding a psychologist or a psychiatrist. So the fact that we have both is incredible because there are so many counties that don't have any, and it's a nationwide trend. Most of your psychologists, they said the average age of most psychologists is over 70 years old. So people aren't going into the field either. So we're gonna see this continue to be a struggle to find psychiatrists and psychologists. And that's something that is a nationwide trend right now.
And thank goodness for telehealth right now too, right? Because that really makes people accessible from all over the nation. We actually, one of our people is actually, she was in New York State, so it's huge that we even have her helping out Richland County residents. It's awesome.
Any other questions, comments?
I'll add to this. Have you guys reached out to like behavioral consulting services? They offer support in that manner, like if you're struggling to get psychiatrists, where they work with Medicaid patients, things like that. So that'd be something
I
that you guys.
feel like I've seen an email from them,
Behavioral consulting services. We utilize them in-house too. And it's a great way that if, you know, you need that extra support that they would assist.
I feel like I got an email. Are you from Sauk County?
Kind of.
No, I know, no.
Oh, yeah, sorry.
No, I know where you're from, Brittany.
Yeah.
Sorry.
No, they're located multiple locations.
Okay, all right.
You guys can even possibly look at Health Drive. Health Drive is another option for consulting services.
Amplify and Cross is opening up a new wing,
Are they?
urgent care for mental health as well.
Okay.
It'll come online 2026, I believe.
And quite a few, and we do get emails occasionally from different facilities that say, hey, we have some beds if you know, or we have these services available. And I feel like the one she just mentioned, I feel like I've got an email and it's somewhere in my list, so for sure.
One other question, you said there was beverage server training
Mhm.
on November 3rd at the Phoenix Center. What time is that?
Believe. Trying to remember. It's in the evening. I want to say it's 4:30 to 5. Like kind of in that either one of those start. I can get back to you with the specific time. I don't think it's been advertised yet. But I know it's in the evening.
Thank you.
Yeah, of course.
Any other questions?
Thank you all. Appreciate it.
Yes, thank you very much. Item number 10, discussion and possible action. Resolution approving provider contract amendment for 2025 for the Health and Human Services Department.
Sure. So currently, Health and Human Services contracts with Red Maple Consulting Services. They're a CCS provider, so individuals use therapists in that program. And what we do is every fall, we put our contracts out there for the next year, right? So, but we do an estimate, what do we think we're gonna be utilizing for the next year, right? Which that'll be coming up soon as well. But for 2025, the original contract amount was, I think, 150,000, but we're trending, projecting that we're going to be at 220,000 that we're gonna need for Red Maple Consulting at the end of the year. Now this is a CCS. I know that sounds like a lot. Now this is a CCS provider. We actually pay $159.26 an hour for their services, so they can see our CCS clients. And then these are 100% reimbursed through CCS, through Medicaid. So this is just an amendment to get us through to the end of the year because it's projecting high.
I need a motion to approve the amendment to this contract.
I'll make that motion. And
Need a second? Any further questions or discussion? All in favor, please say aye. All opposed, same sign. Thank you. Okay, discussion and possible action to approve the application and subsequent acceptance of the 2026 85.21 Specialized Transportation Grant.
So this is a grant that we write for every year. It's provided by the state of Wisconsin. It's one of those grants that if we apply, we generally get this. A certain amount is allocated out for each county. So we actually had our public hearing and transportation coordinating committee meeting yesterday. The total amount of the grant is $79,889. And then it has a 20% required county match, which is $15,978. This provides assistance with providing medical transportation through our driver escort program for our volunteer drivers, and then also helps support our bus program.
Motion to approve.
Have a second?
Second.
Any questions or any discussion? Hearing none, all those in favor, please say aye. All those opposed? Okay. Moving on to county board then. Okay, number 12, discussion and possible action, approve the 2026 vehicle memorandum of understanding with Pine Valley Community Village.
So that is through the transportation program. Again, it was approved through the transportation coordinating committee yesterday. Every year we do a memorandum of understanding with Pine Valley. The ADRC's transportation program writes the grants to be able to get vehicles for county agencies. So we wrote the grant for Pine Valley to be able to get a bus a few years ago. So every year we redo this this memorandum of understanding, and basically Pine Valley covers all the costs for upkeep, for insurance, title, registration, all that kind of stuff. But we do redo this every single year to make sure that it's something that they want to continue with. If at any time they wouldn't want to, or they need a new vehicle, then we would go through the process of applying for a new vehicle, and then that vehicle would be sold, so. And all of the different, oh, go ahead.
Okay, do I hear a second?
Second.
Any questions or discussion? Hearing none. All those in favor, please say aye. All those opposed? None? Understanding is approved. Thank you. Number 13, discussion and possible action. Resolution urging the state of Wisconsin to provide funding to offset the county fiscal impact caused by the enacted federal SNAP changes, and to work with counties to ensure adequate resources for the administration of food share and plate programs.
That was a mouthful.
Yeah.
So as you've heard in the news, since the beginning of the year, a lot of the changes in the federal budget, are going to impact, various programs, that we work with. But so far, this is, Food Share SNAP is the one program that we kind of are starting to get some good details on that financial impact. So, the counties are being asked to, sign off on a resolution. And I think a lot of the counties in the state are doing this to do a resolution, basically supporting the ask, for additional dollars, to fill that gap. And statewide, they're going to ask for 69.2 million. Obviously, that won't all come to us. That'd be great if it would, but it won't. We'll get a little bit of it, but, they're asking for money to, so there's, for the food share program, the federal government, does reviews or we do reviews of our own cases. And Brianna is here. It's been a few years since I did economic support. So if we, by waffle, I'll defer to her, but, cases are quality checked, right? And there's an expectation that the error rate on those cases will be below the 6%. This 6% statewide, that potentially is going to trickle down, and to counties that they're going to maybe have to kick in on that if our error rate was high. So the goal is to use some of this money to improve our QC efforts and kind of maybe get ahead of it so that our cases are correct, so that we keep that QC, like I said, QC error rate in check. So some of the money will go towards that. Also too, with the administrative, there's an administrative reimbursement change. Currently, we have an allocation. If our expenditures exceed that allocation, we've always been really confident to say, okay, we'll get 50 cents back on the dollar, right? For every dollar over, we might go over what we're allocated. They're changing that to get 25 cents back, right? So this resolution is hopefully asking to make us whole, bring us back up to that 50%, right? So we get that extra quarter per dollar. So they're asking for that as well. Yeah, I think in general, those are the two big things, right? Was there anything else that is, I think those were the two big things to offset any, to try and beef up our quality, which is already good. Don't get me wrong, Wisconsin's in a good place. But we just, we're okay, but we want to make sure we stay okay or we get better. We want to get better. And then that 50 cents on the dollar reduction is huge. So I don't have any specific dollar amounts as far as what might trickle down to Richland County necessarily, but at the same token, we want to do this resolution and just say, hey, yeah, let's, we'd like this additional money. So that's in a nutshell what this resolution is.
Need a motion to approve the resolution?
Also,
Okay, I need a second, please. Elaine? Okay. Any other questions or discussion? Hearing none, all those in favor, please say aye. All those opposed, same sign. Resolution will go forward. Number 14, discussion and possible action, approval to pay the penalty from CMS.
That's me.
Okay,
So back when I started in March, about a week after, CMS came in, our state surveyors, they were looking on a complaint. They were looking at change of conditions, for two residents and found, us to be non-compliant in January for two situations. Essentially a change of condition is anything higher than their baseline, that says something's wrong. Essentially, our staffing didn't do the documentation to support the change of condition and whether somebody was improving or, needing additional help. They sent them also to the ER via cab versus ambulance. So we got an IJ, which is an immediate jeopardy, which means something very bad could have happened to these two residents. And so they impose a monetary for those high citations. This monetary penalty is $114,440 to be paid. This is just notice that I will be getting this fine from CMS. This is not the actual invoice, but my hope is that what I will do is break this up in over the next 3 months from when the fine is actually due to be able to not have $114,000 coming out of 1 month where it'll be kind of divided up. So the sooner I can get this approved, I can get this process rolling. So essentially not paying this means we will not get paid. We will lose our credentialing, those sorts of things. So I just need to get paid.
and where is the money gonna come from?
We're working that out.
Okay,
I have that figured out for the most part. So essentially, we're now staffing in accordance with our PPD. So that kind of alleviates that additional funding available. We're gonna be struggling for a little bit. The only reason is we have our water issue now. So we'll find it. I mean, we're doing good billing wise. We're bringing above what we're supposed to be, what we're paying out right now. So this will kind of help alleviate that. But yeah, that's why I'm hoping that if we separate it out, break it down to, I think it's like 38,140, 4667 a month, over the next 3 months. That'll kind of shift it pretty significantly where it'll be more feasible to pay it.
okay, need a motion to approve to pay the penalty.
Can I ask
Sure.
a question?
Yeah.
Yeah, so did you try to appeal any of it at all?
So the problem, we would love to appeal it, but ultimately the documentation was there. When they called the ambulance to verify transportation, called the cabs, got the confirmation and the receipts of these people being transported. It'd be different if we did nothing wrong, right? It's a learning curve. We were having LPNs acting as RNs, kind of pretty much doing the documentation of an RN versus what their scope of practice meant. So going out of our scope of practice prevents us from doing accurate assessments, doing the documentation in accordance with our state and federal regulations. If it were as simple as, we did all the documentation, yes, this would be something we could fight and I would have fought it from the second. But there was no documentation. There was no proof of that documentation. And the proof that we have is the LPNs and that med techs doing things that they shouldn't have been doing during that time. So unfortunately, at this time, I would say, no, there's no possibility of being able to say, no, we can fight this.
Because my concern is like, if we get this, now we can't do like CNA training out there for so long and all that.
Correct.
And that's why I'm wondering if there's someone.
I mean, we don't do the CNA training in-house anyways. They utilize.
We really need to, because we should talk about this at Pine Beth.
Yeah, we'll do that
I'm
at the
saying
Pine
that's a way to get local employees here, so we're not using these agency people.
We do a
So they-
CNA, an RA to CNA program. So we do send them to schools. They come in as an RA and then we send them to become CNAs and then we kind of grow our own CNAs in-house. So I mean, that would not change in general. Regardless, we've got another IJ to somebody deliberately not doing CPR in the building. So that still forfeits us from that. It's just, people, we have to accommodate for human error, but at the same time, we still have to be able to hold our staff accountable, and we have to take accountability for something that wasn't being done. And this is just kind of a reminder of why we want to hold that accountability and keep things in place. We don't want these things to happen.
Yeah, that's why I'm saying that's important, because getting local staff here, local training, and not having these agency people come in this facility, they're only here for the higher pay and they really don't care about, you know what I'm saying? So that's a concern.
Yeah, and there's a lot more discussion we have to look at more so in depth at Pine Valley, because there's a chain of events that occur that is causing essentially our shortage, and it's a national wide kind of thing, and work ethics, and so there's just a lot of things that kind of boil up into causing that issue. So
The only
Let's-
question
let's-
I had.
let's get back, Elaine. We need to get back to the agenda. We will discuss this type of stuff at the Pine Valley. Okay. All right, so I need a motion to approve to pay the penalty.
I approve.
Okay, I need a second.
Second.
Now we can have questions and discussion.
Well, it was just my concern that if we, all this, I read all this, and if this happens, now we have to go 2 years without having in-house training. So I was hoping somehow we could correspond or maybe get something so that isn't part of this whole scenario. Because we
Again.
need to get local staff.
correct. I mean, at the end of the day, even if we were to fight this one, we have another one. And that one is completely unavoidable of getting. I mean, somebody deliberately didn't perform CPR, that automatically is an IJ. We went into a past non-compliance, which means that the second it happened, we corrected it, which hopefully that won't impose a monetary penalty to us. I'm crossing fingers at that point, but either way, we're gonna be on that 2 year. So,
And their agency staff.
thanks.
So you're asking us to vote to approve this, but is there any other option?
There's not, I mean, essentially, something happened, something bad happened, and we are being held accountable. So the state and federal regulations in which are set forth are pretty much, so your federal regulations say this is the basic care completely when it comes to your skilled nursing facilities. And then state piggybacks onto those and says, okay, this may be your basics, but here's what we want to see, and this is our expectations. And essentially, we didn't follow their expectations. You know, we have RNs, we have LPNs, we have all these core staff that we utilize. But essentially, before I came in, people didn't understand their scope of practice. They didn't understand what they were capable of doing, legally what they're able to do, and it kind of caused a lot of issues. When you have LPNs doing the work of an RN, we're not having an RN who has, you know, an additional year to 2 years of schooling, depending on their degree, doing the assessments, in which an LPN's only, you know, have a year of school. So they don't learn like your breath sounds, they don't learn lung sounds, they don't know the assessments of a GI if there's a bleed, or, you know, chest pains. They don't know all those assessments compared to what an RN is taught when coming in.
I'm saying if you don't pay this, say, no, I'm not gonna pay it, what, they're just gonna not reimburse for Medicare and.
Correct, we lose our funding.
So you don't have a choice.
We don't have a choice. But because of the dollar amount, we have to go.
Any other questions?
Low percentage.
Thank you.
Thank you.
Okay. All those in favor, please say aye. All those
Thank you.
opposed? Motion carries. Thank you, Brittany.
Mhm.
Okay, do we have any correspondence from anyone? None. Any future agenda items that someone would like to see?
I have a couple.
Okay.
The opioid settlement grant, for sure. And then hopefully we'll have the 2026 provider contracts. Ready to review.
All right, anything else? I need a motion to adjourn. Nobody has any further questions or statements.
So moved.
Okay.
So we are adjourned. Thank you, everyone.
Sent it to you when,